Hi guys, welcome back to the Adaptive Zone podcast. My name is Matthew Boyd. I'm a physiotherapist and running coach. If you enjoy the show today, don't forget to like and subscribe. And if you're so inclined, please do share it with a fellow injured runner. Today we're going to be talking with Francis Del Duchetto about foot orthoses, orthotics, inserts. They're called different things, but he's done some awesome research on it recently that I read, and I wanted to reach out to him to get him to come on the show and share his finding and his thoughts about orthotics for runners. So, Francis, thank you for joining us, and welcome to the Adaptive Zone podcast.
Thank you for inviting me.
Cool. Could you start by just telling us a little bit about you and your professional work?
Yes, so I'm a podiatrist. I work near Montreal in Quebec. A podiatrist in Quebec is a foot specialist, so we pretty much do everything foot and ankle wise. We don't go above the ankle, but we do pretty much everything. So biomechanics, dermatological care, a little bit of surgery also.
Okay. And recently I reached out to you because I read a paper that you'd written. I'll read out the title just so everyone, and I'll put a link in the show notes to it. It was Can Foot Orthoses Benefit Symptomatic Runners? Mechanistic and Clinical Challenges Through a Scoping Review. So we'll give the sort of layman's take on that in a second, because those academic titles are always a little bit of a mouthful. But we're going to dig into that today. Could you just start by helping some of our listeners who are all going to be runners, just help us understand what are foot orthoses? What are we talking about here?
Yeah, so the definition has changed over the years. But in general term, it's a medical device that's inserted between the foot and the shoe with the intention of treating lower limb pathologies or injuries. There are different types of foot orthoses. There's not a universal classification, but experts generally categorize them into simple foot orthosis, which is just a flat cushion insole on top of which we can add some certain materials. There are prefabricated foot orthoses. So these are the ones that you will commonly see in stores that you can buy. They will have an arch profile in them, but it's not going to be custom made. And then you will have your custom made foot orthoses, which will be made from a mold of the patient foot.
Okay, so all of these would be under the umbrella of orthoses, and I know I think in the US they often call them insoles, but it's the same thing. It's the little inserts or insoles or orthotics that you put in the running shoe, and then I think if I'm understanding correctly, they can either be pretty flat and just a bit of cushioning. They could be like have some like arch support and other like features to provide some kind of biomechanical stability, or we'll get into that in a sec.
Exactly.
But it's like off the shelf. So you might go into Shoppers or your local like drugstore, and you can see a bunch of them on the shelf, and you can just pick some off and put them in your running shoes. That's the kind of prefabricated ones.
Exactly.
And then you can have like the custom ones, which is where you might see, is it someone like yourself? They would take measurements and moldings and other things, and then have some orthoses created specifically for you. And that would be like a custom, what would you call that one?
Custom made foot orthosis.
Cool. Okay. And they're the three different types. Did I get that correctly?
Yes, exactly.
Okay. And so what, in your review that you did, where you were looking at orthoses in runners, why did you want to look into that? What got you interested in that in the first place?
Well, from a literature perspective, there's quite a lack of understanding of the effects of foot orthoses. So what do they do and how do they do it for injured runners? There's a growing body of evidence about their direct biomechanical effects on healthy runners, which is usually the first step of what you do in research when you're researching a treatment method. And then afterwards, you kind of need some evidence about injured runners. So there are quite a few studies out there, but there were no review about them. So that's why we did the review. On a more personal note, I like running. I like every runner. I get injured. And mostly what I knew about foot orthosis for running injuries came from just general knowledge about foot orthosis, general studies about them. So I wanted to do my own objective literature review and then provide a good summary for other clinicians and future researchers.
So you were focused more on looking at the research that has been done on whether foot orthoses are helpful for running injuries, as opposed to previous research reviewed. Previous reviews have looked at the research on whether foot orthoses, what effects they have on healthy runners. Is that the difference there?
Yeah, exactly.
Okay.
Exactly. That's the key difference.
And then how do you do that? Like, what did your review look like? How do you do that?
Yeah. So we did a scoping review, which is kind of a newer type of literature review. It's mostly done to just explore a research topic. So if a research topic is quite general, it's quite variable also. So there you cannot really do a systematic review. So we just wanted to explore that topic, identify and map the available evidence of what's out there. So that's why our question was very general on what are the effects of foot orthosis for injured runners.
Right, okay. So you were just kind of taking like a broad, like, let's just see what's out there and sum it up for people so we can see what's going on. Okay, that makes sense.
So that's good for clinicians. That's also a good precursor for further research and further systematic reviews, which then come in with a more specific question.
Okay. And then, I mean, you may not know this off the top of your head, but once you sort of got into the review and you were looking at the different papers that have been done by other researchers and you were going to review them, like how many papers did you end up with roughly?
We ended up with 30 papers.
Okay. And then how did you sort of group them in different ways for like different injuries or anything like that?
Nope, not really. So it's for a scoping review, you don't really classify the papers. We critically appraised their quality, so with a quality scale, and then just went into making just big Excel tables about everything they mentioned and every biomechanical or other effects, their effects on treatment, their effectiveness, everything.
Okay.
So no, we didn't really classify them. But we also looked and tried to identify the factors that would influence the effects of the foot orthosis. So would, let's say, the type of foot orthosis influence how they affect the foot in injured runners.
Right, okay. And so, like, this might be too big a question. We'll probably need to break it down a little bit. But what did you find in these 30 papers? What were the things that you take away from the reviewing all of that?
If we can stick to maybe more something that's more interesting for just general runners. For clinicians, we have some specific recommendation. But the biggest thing I think we gotten out of it is the purpose of the foot orthosis for injured runners, which would be to take the load from the injured structure and redistribute that load into non-injured structures. So that can explain how they're beneficial for injured runners. We also found that they're beneficial when they're included into a multimodal treatment approach. So when they're used only when is like the only treatment you're using, they're not as effective as first line treatment like rehab exercises. But you can use them and they can be effective. They can increase the effectiveness, let's say, of a multimodal treatment approach.
Okay, well, I think that one's quite an easy one to start with, and then we can go back to the second one. So the first one. The second thing you said was that, if you're an injured runner and orthoses are going to be used to help with the treatment, it should be probably part of a more comprehensive program that might involve, management from a sports doctor, physiotherapist, podiatrist who'll get you to do exercises, stretches, adjust your training, your technique, like all sorts of different things. And orthoses will be part of that. That's a better way to go from the research we have than just saying, okay, I've got knee pain, here's your orthoses, just go and keep running. It's better to do it as part of a combined approach.
Exactly. So
Okay.
it comes back a little bit to your pyramid that you alluded to in your last episode about running shoes, where you need to address your base first, which would be to increase the resilience of the injured structure, build the strength of the surrounding muscles. And then you can think about addressing the biomechanics, so with the foot orthosis. But you need that base. And when we include the foot orthosis, we need to continue the other treatment approach, but would, in that case, would be rehab exercises.
So I think my takeaway from that is that you're saying that they're not going to be a silver bullet pretty much ever, but that we do have evidence that they help. So for
Exactly.
certain conditions and certain situations, I don't know if proof is the right word, but we have evidence that they are effective at helping resolve running injuries in certain situations. We could
Exactly.
say
So,
that now. Is that the takeaway?
yeah, that's the takeaway. So, yeah, to proof is quite a taboo word
Yeah,
in
definitely.
research, but yes, there is evidence indicating that they can be effective for lower limb injuries for runners. Yeah.
Nice. Okay, cool. So then could you give us some examples of the first thing you said, where you said like they change or they redistribute stress or forces from the injured tissue or the injured structure or part to a different part when we're running? Could you give us some like practical examples, maybe with a specific injury that might help us understand what you mean there?
Yeah. So, for example, if you have a runner that comes in with medial ankle pain, let's say from a posterior tibialis tendinopathy, you could use the foot orthosis to redistribute the load from that injured structures onto healthy structures, let's say the lateral ankle structures, that could contribute to the treatment of the condition and decrease the pain also.
That makes sense. I think that was something I took away from the paper is that came up as a recurring theme was that they seem to redistribute forces like away from the middle, like the sort of arch area of the foot, and move them more towards the outside of the foot. Would that be fair to say? Or
That's what the evidence suggests, because most of the studies were done on participants with which had more pronated feet, so flat feet. So that's the evidence. My takeaway as a clinician is that, well, what you do with the foot orthosis is going to influence how the loads are distributed. So if you have a lateral ankle pain, let's say, you could use the foot orthosis to shift these loads more medially if you wanted to.
Right, so if you were, that would be more of a custom orthotic or making certain modifications. You could move forces a different way.
Exactly.
But just generally the thing that's been researched the most that's what I noticed. Okay,
Exactly.
that makes sense. Okay, so what about things, so that you gave us an example of like what I would call an inner ankle pain there. What about other pains like shin splints and knee pain? Like because these are really common running injuries. Can orthoses help with those things?
Exactly. So yes, they can. So the studies that we included showed evidence for knee, ankle, and foot pathologies. For the knee, it was mostly about patellofemoral pain syndrome. There was evidence for MTSS, or medial tibial stress syndrome. A little evidence about Achilles tendinopathy also, and plantar fasciopathy.
Right. So those running conditions, again, we have some evidence that orthoses can help with these things.
Yeah.
Cool. So I guess we might venture a little away from the research that you did into your kind of clinical takeaways from it for this next bit, if that's okay. But if you would say, like, based on your understanding of the research and how orthoses should be used, something I've always wondered is, like, say a runner is not having any pain. Would it be wise to use orthoses to try and prevent pain or, to try and prevent injuries? Or is it better to just kind of leave well alone until you do start to have problems and then consider using orthoses? What would your personal takeaway be on that one?
Well, I don't have a clear cut answer for that. There's low to moderate quality evidence that would suggest that custom-made foot orthoses can prevent injuries, well, lower limb injuries for runners. But because there's not good quality evidence about it, and because I think there's just so much other things that you could address before addressing biomechanics with a foot orthosis to prevent injury, like training volume, the resiliency of the structures, the strengths of the muscle, sleeping pattern, training habits, and so much other things to address. I think are more important. So as a clinician, I usually don't recommend them to prevent running injuries. And part of the reason I said, and other parts, is that if you, theoretically, if you use a foot orthosis and you get used to it, well, you're kind of stuck with it. Because if you want to get rid of it, you'll have to do a progression. If you just remove it from one day to the next, you'll expose yourself to an injury because your structures won't be used to that kind of, to the other stress. It will be used to the stress that they receive when the foot orthosis is present. So you're kind of putting yourself into a situation where you need your foot orthosis to not get injured.
That was going to be my next question.
Kind of makes sense.
Actually. Yeah, it does. And I'm going to unpack that in a bit with you, if that's okay. The first thing you said, though, is that, like, as a prevention as opposed to a treatment, maybe not so keen on that method. But as a treatment, there does seem to be some good evidence now that they are helpful for knee pain, for shin pain, for Achilles and plantar fasciitis. And then say you do have treatment. So say a runner had shin pain and they went to see you and you gave them some orthoses as part of their treatment, that you would do other things as well, because you said that's a better way to go in terms of making sure you get the best result. So you're doing some other things as well, and you prescribe some orthoses. What do you recommend for the long term for that runner? So presuming the shin pain resolves within, let's say, 2 or 3 months, just to pick a number, what do they do after that?
So personally, I let them choose. I explain the consequence to them. So when the pain is resolved, I usually ask them to come back to see me, and then I let them choose either to keep the orthotic, so the foot orthosis, and explain to them that you'll kind of need to change them every so often because they can get quite used. Or we remove them progressively. So I usually just go by the rule of 10%. So we'll gradually include kilometers without foot orthosis within your week. A little bit like if you're coming back from an injury, well, this time you just keep your normal training, but gradually remove your orthoses.
Okay. So it either is a reasonable option in your mind, like you could wean off them over a period of time, maybe 10% every set interval, or you can kind of keep them in. If they decide that they like them or want to keep them in long term, do you need to get a new pair, like shoes kind of wear out? Do you need to get a new set of orthoses every so often?
It depends on the material of your foot orthotic. I think some material are more resilient than others, and depends on how it's done. Also, if you use softer materials on top, that will get used faster than, let's say, the base of the orthosis that can be made from plastic materials. By experience, over time, the foot can change also. So sometimes the foot orthotic can become uncomfortable, so that's a sign to change. It's really individual, but it can last like 5 to 10 years. If the base of the orthotic is good, it can last quite a long time. There's also no reported side effects, like negative side effects of wearing a foot orthotic. There's a side effect. Well, the side effect is that you're going to pay for it. That's the
right. Yeah, you have to buy it.
Let's not kid ourselves. Custom-made foot orthoses are not cheap.
Right. Okay.
But yeah, it's pretty much either or. I wean them off, or they can choose to keep them.
So I guess the I have two questions on that. One might be a little bit big to kind of really dig into, but just your kind of your sort of cliff notes. Like a lot of people would advocate that having the orthotic in might allow your foot to get weaker. You know, if you were to contrast that with, you know, running in bare feet or sandals or very minimalist shoes.
Yeah.
What are your thoughts on that?
There's actually no evidence that would suggest that from a literature standpoint that I know of. I didn't really do an in-depth review of that literature. But from just a logical sense, the orthotics do not remove stress. They do not remove the load. They simply redistribute it to other structures. So nothing is lost about the load. So your foot doesn't really get weaker. It just gets used to another distribution of stress.
Yeah, that makes perfect sense. I didn't really think of it in that way. Yeah, because it's not like you lose body mass. Like
Exactly.
It's still just as heavy each time you hit the ground.
Yeah.
So there's the same amount of force to deal with. Okay.
Yeah, it comes back a little bit to the saying, like, nothing is created, nothing is lost, everything is just transformed.
Yeah. And then, I forgot my other question. So you said the thing, and that made me think of the barefoot. Oh, that was it. Yeah. The custom versus what you might call off the shelf or prefabricated, you know, not custom versus custom, because there's a price difference there. What are your thoughts on the pros and cons of the two different options?
Yeah, that's a really good question. And a point that I wanted to make today also is that there's no evidence that would suggest that one type of foot orthosis is better than another one for injured runners. So I just generally apply a progressive approach where I start with, the patient will choose, but I will usually start with a cheaper insole, so either a simple one or a prefabricated one. And then if we don't really have the results that we want to, then we'll move on to the custom-made foot orthotics.
Okay, yeah, that makes sense. Yeah, I think that pretty much covers everything that I wanted to ask about the study that you did. And it was I was going through it again this morning before I was calling that. Like it must have been a ton of work. It must have been an absolute ton. So thank you for doing that to sum it up for clinicians like myself who do not have time to dig into that much research in that much detail. And I learned a lot when I read it. So thank you for your hard work on that. We benefit from that. So thank you.
Thanks. Well, I was definitely not alone in that. There were the other authors, mentioned Chloe and Yosra, who were pretty much essential to that research. And yes, you can say I lost quite a bit of hair doing that study. It was a lot of energy.
And, I'll provide a link in the description to, I believe the full access paper might be online. If there it is, I'll put that on the show notes so readers can, so listeners can get access to the full thing. Is there anywhere else that, like I can put a link to your ResearchGate profile, for example, is there anywhere else that you'd like to direct listeners to if they want to kind of follow your work in the future or anything like that?
I think the easiest way to follow my research would be on ResearchGate.
Yeah, I can put your link to the
profile on that. And I have other profiles, but I'm not really active on them. I should be a little bit more proactive on that side. But the easiest way would be ResearchGate.
They have a name for it now, don't they, in the research world, where you guys have to get out there and get your research like known and promoted and do things like this. I can't remember the name of it, but one of the other researchers I had on told me that it's part of his job now.
Yeah. Well, I'm still mostly a clinician right now, so not doing research full time. So I don't have a big focus on getting out there and pushing my research.
Fair enough.
It's something I should do.
With your own career, like where are you going in the future? What are you interested in and planning to look more into?
So right now I'm doing a postgraduate degree in London in the UK on podiatric sports medicine with other researchers here, and it's been up to now. I've been doing that 2 months. It's been really a good experience.
Wow, cool.
My goal is to then come back in Montreal have a private practice that would tend towards more the sports. I would like to be included in a professional sport team also, and do a little bit of research and probably teach also.
Cool. That
Yeah.
sounds very exciting. So I'll keep track of your ResearchGate profile over the years and see what you come up with. And if I'm ever back in Montreal, I was just for the listeners before we got online, I was telling Francis that my first ever marathon, I've told the story many times on this show, was in Montreal. So Montreal's a very special place for me.
Yeah.
Well, one thing I did think that I didn't ask, actually, that I didn't mean to ask, was that runners, when they get orthoses or insoles, they often ask me like which shoes to put them in. Like, does it matter? Because different shoes, like you might get some shoes with more cushioning, some which have like more of a motion control or more stability on the medial or inner side. Like, how, if someone were to be using orthoses as part of presumably a strategy involving a clinician, how might they choose what running shoes they were going to put them in?
That I would say that it doesn't really matter what shoes they put them in, but you should let the clinician know what shoes you intend to put them in. So if it's a motion control shoe, well, we know that there are certain stability elements more towards the medial side. So usually, well, we'll do the foot orthosis, but sometimes adjust it a little bit so there's not too much pressure on the medial side. You need to know that if the foot orthosis is made for, let's say, the motion control shoe, if you put it more in a neutral shoe, well, the stresses will be different because you will lose that motion control aspect of the shoe. So yeah, if that answers the question.
It does, I guess. Then if you were to look at a off-the-shelf one, would that typically go in the shoe that you usually use, whether it's motion control or neutral, or would it be maybe better to put it in a neutral shoe if it was an off-the-shelf, not non-custom insole?
I would just put it in the shoe that you're using. Same for the custom made. Also, just put it in whatever shoe fits for you.
That makes sense. So you're keeping the shoe controlled, like
exactly.
the same.
So that's the constant, and then just modifying with the insole.
That makes sense. So you don't want to buy a new pair of shoes the same day you get new insoles.
Well, you could, but the adaptation period might take a little bit longer. So when you get a new insole, there's an adaptation period to be made because you're changing the stress put upon your lower limb. And then if you're also including a new shoe with that, well, that's another difference. Right. So first there's a longer adaptation period, and then you'll be put in a situation where is the insole working or is the shoe working? And if it's not working, which is not working? Right. So we usually just go step by step. It's
change one thing at a time so you know what's happening and how your body's responding. That makes sense. It also made me think, like, if a runner were to be using orthoses in conjunction with a health professional to treat an injury, how would they, would it be, say I'm running 5 days a week at the minute. Would I then just put, I get my insole, I put it in, and then I continue 5 days a week? Or would I wean into it? Do you know what I mean? Like maybe do it every other day or take it out halfway through my runs? Like how would they, for that adaptation period?
So you definitely would want to wean into it. Or if, let's say, you're injured and doing a return to run progressively, then you'll just put your insoles 100% of the time. So if you're just starting back on the program of doing run walk time 10 times 1 minute, well, you just put your insoles right into them. But if you have a constant volume and you want to put an insole, then you would definitely want to wean them in.
Yeah, that makes sense.
And usually I just use the rule of 10%, 10 to 20% increase every week.
Right. Okay. So it's quite conservative then.
Yeah, it's quite conservative. If that's for someone that would, let's say, have a regular running volume, and it's not doing any other progression. Because usually an injured runner, well, you will want to do like a running back to run progression.
Yes.
So it's actually quite rare that I would suggest like a wean-in period, because I'm always doing the return to run program with those.
Which makes sense.
runners.
So let's say it was a more mild injury. I know you can't, like, it depends this, obviously.
Yeah,
I'm just trying to get a sense of your reasoning. Like, let's say a runner, they only got pain if they went more than 3 miles. So they were running 4 days a week. They were running up to 4 miles. They were having little walk breaks so that they could gradually build it up. They're working with a health professional like me or you. We're trying to add a little bit more each week, a little bit at a time. How would they bring the orthoses into that plan?
I usually just recommend them to bring a little backpack when you go out and run. Put your insoles in your shoe, and bring the other insoles of your shoe in your backpack. And up to a certain distance, then you just switch.
Yeah, and that would depend on how much they're doing. So someone who's like only getting pain when they go over 50 miles a week, you would bring the orthoses in for like 20%, 10, 20%. Whereas if they were only running like half a mile 4 days a week because the injury is quite bad at this stage, you might have them wear it for the whole thing because it's only a small amount.
Yeah.
Got you.
But in both cases, let's say in the first case, I would work towards wearing them 100% of the time.
Yeah. And then when you're wearing them 100% of the time, then you're going to continue building the running volume up.
Exactly. Another approach that could be used in that case would be to do usually runners will wear their insole in everyday shoe and in their running shoe. So you have to do your everyday progression before you do your running progression, usually. And then the running progression can be more aggressive because you've gotten used to them in other ways.
Yeah, okay. So how long might that take, the everyday progression? Like, how would you do that bit?
It's usually over 2 weeks. The simple way of doing it is just 1 hour per day. So that's not really based on any scientific evidence. It's just clinical experience, where we say the first day you wear them for 1 hour, second day 2 hours, third day 3 hours, and so on forth.
And if they're getting too sore, your feet are getting sore, you would go a little slower. And if it feels fine, you just follow that. Yeah, that makes sense. Okay, cool. That was great.
I know. Some people can get blisters also. So, like, if there's any discomfort or anything that arises, then just go back to the clinician, adjust a little bit the insole, and then go back to your progression.
Yeah, perfect. Cool. That was great. It was really nice to get the both sides, like the evidence of what you found that we have kind of research for, and like your practical kind of takeaways from it that we can like implement ourselves. So that was really great. So thank you for coming on, Francis, and look forward to chatting with you again in the future. Thank you.
You're very welcome. Thanks again for the invite.